Welcome to our sixth episode of the Lebanese Physicians Podcast today. And today, this will be a very important interview for me. I'm interviewing a person who I worked with and I love a lot. It's Dr. Rajaa Chatila, who is currently the Assistant Dean for Graduate Medical Education at the Lebanese American University School of Medicine and has been in Lebanon for a long time. Rajaa, I've worked hard on getting this interview with you, and I'm very happy today that I'm talking to you. Can you tell us more about your journey? And I know you were in the U.S. before. You did your fellowship at GI fellowship at Yale, and then moved back to Lebanon. Can you tell us about your journey in Lebanon? I know also that you're a very big advocate of the country and of trying to make things better in it.
Well, thank you so much, Khalil. It's so nice to see you and to talk to you, and we definitely miss you. Where can I start? I guess it's been a long time since, as you mentioned, I went back to Lebanon. So I did my last part of training was at Yale University, where I did my fellowship, and I was planning at the time to stay in the United States. We were working on my visa, so I got what's called the O1 visa at the time, and I wanted to go back to finish my paperwork and see my family. And then when I came back, I really had big second thoughts about the whole mission. So I thought, well, this is my true plan was, according to what I left for, was to get the best training I could, and that I would want to come back and to serve my country, men and women. And so those thoughts came very strongly back. And you know how it is in Lebanon and in Lebanon. We have really strong family and social ties, and these matter a lot. So family life and social connections are quite strong. Everybody knows everybody, and I thought coming back would make a difference, and so I decided to stay.
Yep.
It was I'm sure that I left some people a bit upset because they were betting on me coming back to fulfill certain duties beyond the schedule, clinic time, etc. But then my mind was set. I wanted to stay back in Lebanon. It was a bifurcation, a crossroad. So I would just come back to Lebanon, or I would have to stay for a much longer time in the United States. And my choice was, خلاص, it's time to go back home.
Yep.
And it wasn't easy. I don't know if this is what you want to hear, Khalil.
No, I know, because I know that it's not easy, but I know that also you are a very big advocate for your patients and for the residents, and I think throughout your career you've been an advocate for that and for helping a lot of needy patients out. Yes, I wanted to hear slightly a bit about your experience in Lebanon, and also I'm very impressed by your dedication to the profession in Lebanon and to furthering it and to your patients too.
Yes. So as I was saying, it wasn't easy also to start the career in Lebanon.
Yeah.
So you know how it is in the United States. Things are sort of, the system is running, it's all set up. You just join, you go in like in a puzzle, and you just everything is working. You have the patients coming. In Lebanon, it's different. You had to actually struggle to build a name, to build your reputation, to build your career. But all the time it was working for a mission. You wanted to give the best medical care you could for people who would otherwise not maybe not have that opportunity. So it didn't take long for people to get to know me, and for me to start building that practice. And because I always loved to teach, I wanted to associate with a university hospital. But I wasn't successful. When I first came, I wasn't successful. So, although when I went to the United States, I went to have particular training in hepatology, having a position when I would come back, that didn't happen. So I worked in a private hospital, and then eventually I started working also at Rafiq Hariri University Hospital, where I was involved in the supervision and training of residents and students from AUB and from the Lebanese University, and then eventually, and also Beirut Arab University. And then in 2009, I joined the LAU. And this was really finally where I wanted to be. I always wanted to be in an academic atmosphere. Although it was nice initially, I established an endoscopy unit in the hospitals where I worked. There was no endoscopy; everything was done in the OR. So it was nice to create things, but then now I feel a bit more settled, and I'm really more involved in teaching the students and in supervising the residents, and so this is very nice. And everything was going more or less in the right direction till things started really going really bad over the last 2 to 3 years. Over the you see,
Yeah,
it
and
was never
that's
100%.
when I moved back myself, I think, right?
Yes. Yes, exactly. Exactly. Very unfortunate times, but the leadership in Lebanon really were given a good opportunity to make something better, but they really flunked big time. And it was always accusations, accusations, back and forth, and everything was in limbo. And it was just a disaster waiting to happen. And this is what happened. I mean, eventually, all the economic meltdown, the protests in the streets back in October 2019, soon to be followed with the eruption of the COVID in December in China, and to arrive in Lebanon, the first case was in February.
February.
And from there on, it was, you know, the story. It was really from bad to worse and non-stop downhill.
Right, right.
So it has been very difficult. So we had an acute devaluation of the currency. So we used to have, as you know, 1,500 Lebanese liras equals $1, and now all of a sudden, in the black market, it's up to 9,000. But not only that, all our money was confiscated by this big scheme. So you cannot withdraw your money, you cannot take your money, you cannot use it. And this really put a lot of pressures all of a sudden on people, for example, who have their kids studying in Lebanon. They had to pay their tuitions. Our own resident students, everything changed overnight almost. Within days, things were really in a very bad situation. So as far as residents are concerned, we of course, you know that we at the moment we were working towards getting accreditations and getting
Right,
what we call
right.
ACGMEI accreditation, and so everything was put on hold, and then. Although we don't have the American board because it's not given outside the United States, so
Right.
we were just settling for having them do the training exams every year. I'm talking about the different specialties.
Right, right. And I know
All
I
the
because
17 different
I was,
residencies.
I started the fellowship and we did one in training exam when I was there for the fellowship too. We were doing it for all, and we were doing it for all the residencies
Yes,
at the
even
time.
for fellowships,
Yeah,
exactly.
yeah.
Yes, so residents and fellowships, we have around 4 or 5 different fellowships in addition to the 17 different programs. Now with the economic situation and the pressure on the hospital and the university, we're having to cut corners. So now we're asked to try to contain costs as much as we can, and so we're always thinking of how to save money, maybe to do the entraining exams every other year, or maybe just to do these entraining exams for the senior years, or so these are all thoughts in the process. So this year we managed to deliver the entraining exams for all those programs except for the programs where the entraining was in August, at the time of the blast, so we didn't. And
Yeah.
so this is where we are now. It's a lot of hardship. We're having a lot of attrition. So many of the residents are leaving prematurely the program. People who never wanted to leave the country are applying elsewhere. So we're really drained on every aspect. We're
Yeah. Yeah.
drained because we're having this brain drain. Our best applicants, our best residents, our best trainees want to leave, our students, our best physicians and teachers like yourself also have left us. And so it's really, this year was a dark year for Lebanon and for our university
Yeah.
and for the
Yeah.
country as a whole.
Yeah. And I see, and I see
But,
that. Yeah. Go ahead.
but I still was thinking, things in Lebanon couldn't have continued the way they were. Too much corruption and people not getting asked of what are you doing with what you're stealing. And
Right.
so although it sounds like very bad how it is, I am hoping that this has to bring major change. And there's a very nice saying in French. My husband is a francophone, so he knows how to say it better. But you cannot make a cake without breaking eggs. So we're in the breaking eggs phase of the cake making, hopefully. So things must turn to the better. Even with COVID, I'm sure with the vaccine and everything. So there's always light at the end of the tunnel, and it's just that we have to go through this bottleneck that we're passing through right now. And I'm hoping that it has to change. It cannot keep going down.
Right.
This is
Exactly. Exactly. I mean, things happen for a reason. It may be happening to make
yes,
people wake up and say, you know what, this what we were living was not the correct way, and maybe things need to change
yes.
at this point, and this will stimulate people to change the status quo that's been there for the past 30 years or even more, I guess, in that from
Yes,
that standpoint.
exactly.
Yeah, yeah. And we touched, I think we touched on the university having trouble, right, paying for in-service
Yes,
exams, for outside money, and that is because of the limitations that the banks in Lebanon are putting on what we call fresh dollars or dollars
exactly.
paid outside the country. And I think, do you see, as assistant dean for GME, do you see that that is also affecting because I know when I was there too, I felt it was affecting the students, their psychological well-being even, and the residents. So do you see it's
Yes.
affected the residents and students' ability to even leave the country and go outside or to apply for exams outside?
Yes, it's definitely affecting them psychologically for sure. Now, we're trying to mitigate that by doing a lot of counseling sessions, group sessions, yes, as well as we're hooking people who are more fragile with psychiatrists to do one-to-one psychiatric counseling, that sort of thing. The good lessons about all this, the two traumas that we've been through, the crisis of the COVID and the blast afterwards, was really the big lesson learned that maybe we needed to pay more attention to the well-being of residents and students and all our trainees. So we're trying to now incorporate programs that consider maybe every several weeks or something like that, maybe to give people time just for well-being, to counsel, to de-stress, these are things that we're starting to think about. Because undoubtedly these are areas that we didn't pay too much attention to. We always thought of ourselves as being very resilient. And indeed, I think, being somebody who is a generation of the Civil War, we could see that we were strong, we were tough. And our residents and trainees who are younger and now seeing the blast, for example, they went through acute generalized anxiety situations and something like maybe PTSD-like things. But now most of the people are out of it. We don't have a lot who have needed to resort to medications. It was all due to counseling. But
Right.
what the unfortunate part about this, the blast, is that people who were thinking back and forth whether to stay or leave now are more for leaving. And this is what really saddens me personally.
Yeah, yeah.
But, uh, but this is how it is.
And that is why I hope like this. I mean, I know it's always there's a light at the end of the tunnel. I think there's nothing that stays the same, and I hope that light starts showing soon, so people will
It should, yes.
decide to stay, right? And
Yeah, or come back. Or
or
come
come
back,
or come
maybe.
back. Right, right, exactly.
Yes.
Because if they leave and they stay outside for a long time, then it's going to be harder for them to come back if it takes a long
To
time
come
for
back.
things to get better. So do you see that there could be a role? I mean, that's what we're thinking. We were talking about it before we started this podcast interview. I think. Do you see that there's a role potentially for physicians and other Lebanese living outside of Lebanon in terms of trying to help the trainees in Lebanon be able to achieve, I guess, their dreams, be able to go train outside? Because I mean, it's good to stay in Lebanon, but also it's good always for them to leave, do the training somewhere else, and potentially if they want to come back, then come back and help the country. Do you see that there could be
Yes.
a role for that?
Yes, I think absolutely there is. I think it doesn't take a lot for people just to come together and to try to help if there is the will. And I think that once there is a will to help, there are a lot of things that can be done. So if, for example, first of all, in view of the COVID worldwide, maybe we can. First of all, I think what we need to address is the status of Lebanon as a country with the WHO. We really need to readdress that. They keep considering us as a middle income country or a moderate income country, whereas we're really an impoverished country with more than 60% of the Lebanese population below poverty level. So I think if we can have connections with the WHO so that they reclassify Lebanon, because immediately that puts down a lot of the burden from a lot of the platforms for education. You know, many of the educational resources that are good level resources are for pay, they are not free. But if you are coming from a poor country, immediately there's a different bracket of salary, of prices
Okay.
to subscribe with these platforms. So this is something that we can do and we should. And then I think we need to create a fund or something of that sort. The fund should be, for example, to enable students who want to do their steps to be able to do them. At least we can give opportunities. Maybe we can put a grid for those who are really interested in going to give them a chance to do these tests just for once, maybe, so we can subsidize the fee and we can help out that way. So if we create a fund for those who needed to do tests to join programs outside to go for the match. And I think we have a lot of expatriates, a lot of Lebanese in the United States. And if we can create this sort of fund to donate, it shouldn't take a lot to be able to help a lot of students here.
Right, right.
And as I said, immediately, if you say that you're coming from a really poor income country, the prices of those tests there should be also lower.
Go down.
So this is what I think. I definitely think we need to do something.
Yeah.
لأنه we shouldn't. The hardest thing that can affect someone if you kill their dream, we should never stop dreaming, because it is always with dreams that you achieve your heights, you go places. And this is the most important thing to keep alive, is to keep people's dreams alive. And of course, people have the right to go pursue education outside, training outside, but they should never forget their country,
Right,
because
right.
this is where they need to come back and give back.
Right, right, right. Exactly. And I think people can help. Hopefully, people who have left or people who have stayed, they can help from wherever they are. I think. And do you think? And one question I have with this fund, I think creating this fund is a good way of doing it. Do you think there's an avenue, let's say through LAU, because I think it could be created as a fund for all universities, could be created with each separate university alone. Do you think there could be an avenue through LAU to do that?
Well, yes, because LAU has an office in New York.
Right, right.
And it has an account that is a US account, so
Right.
that then you can deposit that money in that account. The only thing is that whoever runs this fund needs to have to be fair and to give equal opportunity for all. I think it's time to come together and to stop this segregation. After all, whether the student is coming from the Lebanese university, from the American university, from the Lebanese American university, they are all Lebanese who are looking for the fulfillment of their dreams.
Right,
and
right.
I really am for unity rather than just segregation. Whether to do it under the umbrella of LAU or I think yes, it can be doable as long as and I'm sure that with the LAU we can have somebody who gives that opportunity to all students who want to apply. So
Right,
not
right.
to restrict it.
Exactly, exactly. And I think to give it to the best students too, like according to their
Yes, whoever applies the
merit.
best should take it.
Exactly, according to merit and stuff like that. So, and how's the corona situation right now in Lebanon? I know it's or at least at the hospital at Rizq.
We were doing very well with the corona situation, Khalil, till the blast. After the blast, we started to see those numbers jumping
Increase.
to 500, 800 cases, etc. And they haven't gone down really. Only recently, maybe a little bit of, with the recent lockdown, a little bit of curtailment in the numbers, but we're seeing a lot of numbers of COVID.
Right.
And I think if the lockdown continues a little bit longer, we might be able to recontain the situation pending the arrival of the vaccines. Because now we're expecting the WHO has donated a good a sum of money to get vaccines, and then there are also private sectors getting different forms of vaccine. I think we're going to get like all vaccines will be available in the Lebanese market. The Pfizer one, I don't know about Moderna, but Pfizer, the Russian one, the Chinese one, every sort of vaccine available.
Yeah, yeah.
We will have our pick from.
Right.
Yeah.
Hopefully soon. That way we can. That way at least the number of infections will start going down. Because I know it's a big drain on resources too. These patients get admitted, they stay for a long time, and
Yes,
require a lot
they
of
get
medical
vaccines.
care. Right. Right.
Yes, and a very sad, very bad disease.
Right. Exactly. Exactly. Yeah. Thank you, Raja, for taking the time to talk to me. I think just to summarize what we've talked about, I think we talked about the financial situation in Lebanon, which has affected and is affecting the ability of universities to pay for outside exams and anything, basically anything that needs outside dollars for the residents and students, and it's also affecting the students and residents themselves in terms of their abilities to sit for their exams that need to be done outside the country. Do you have anything else to add to this, or?
No, first I want to commend you. I want to commend you on the idea. I think I really we're lucky that you're thinking along those lines, and it's always good to see this enthusiasm and the willingness to help. This is something that I admire in you, Khalil, and keep it up. We need your support.
And I admire that in you too.
Thank you so much. Thank you.
Thank you, Raja. Thanks.